I'm Jillian Lonson, Vice President of Benefits Administration and Operations here at Capital RX. I joined the company back in October of 2020, and I bring over 20 years of experience in pharmacy benefit management and healthcare. With a project, my background is in project management, and I'm really passionate about delivering meaningful, results-driven solutions, and I thrive navigating complex challenges to drive very impactful outcomes. Today's webinar is all about helping you cut through the complexity of pharmacy benefits to uncover strategies that truly work. We'll explore how our platform, Judi, is transforming care delivery and driving better outcomes through seamless, integrated benefit experiences. Jeff, you want to introduce yourself?
Thank you, Jillian. So I'm Jeff Brockner. I'm a Senior Manager of Customer Success in our IT product department here at Capital RX. I've been working in PBM and benefits for, let's just say a long time, Jillian. How does that sound? Today, I provide Judi product knowledge to our customers and guidance to our Capital RX development teams. This includes having a trusted relationship with our customers for implementation and support, and creating clear requirements for our development teams to ensure customer needs are met. So we sort of focus on solving adjudication problems with our customers. I also do some Judi training and some Judi demos as well. So let's just take a quick look at the agenda we have for you today. We're going to do a little intro to Judi, and we'll then launch into, as Jillian said, some cost containment strategies, some operational efficiencies, and demonstrate the power of data. We'll talk a little bit about the impact on the member experience that Judi has. And then, as Justin introduced just a moment ago, we'll have a time for Q&A as well. So with that, we're going to launch a quick poll and take about 20 seconds to go ahead and click a button, and we'll take a quick look at the results. All right. Jillian, do you want to close the poll? Perfect. All right, looks like, almost a dead heat of everything too. So we're gonna definitely talk about cost savings and greater visibility and transparency. I think those are some themes that you will get very much out of this. Do you have any other observations?
It's interesting that everything's sort of in line. So yeah, I mean, I'm really excited to get through, and hopefully some of these answers that we go through will really help you kind of tie everything together and what we're trying to do here at Capital RX.
Great. I'm going to hit close on the poll, Jillian, and we'll go ahead and go off to the next one. So the beauty of simplification and Judi. So we're going to show you why we are more customer focused and why Judi is better, faster, and smarter. It's a unified enterprise health platform for both medical and pharmacy. The impact of having one platform and a holistic plan approach, it helps you with the plan design and with your member experience. We're talking about all functions being integrated here. They share information throughout the platform. So it's comprehensive. Benefits, eligibility, accumulations, network, formulary, prior authorization, the member app, the member portal, reporting, finance, and underwriting, all integrated together. In Judi, we have built tools to handle customization requests and configuration for new regulatory or business requirements. These tools result in a faster output, better outcomes, improved operational efficiencies, and an exceptional member experience. We have made Judi future-proof and flexible. You will notice that we also have a number of accreditations and certifications. Judi is a cloud-based application, and we use open API technology. We think about this stuff all the time. How to support the myriad of benefits, both commercial and government. How to make Judi simple and easy to use. How to make finding the information you want easily available. We're going to show you some of those advanced features in Judi. We're going to show you that we're prepared for anything, and we mean anything. No benefit is too complex. No report is too crazy, no matter what. where it's not going to take 18 months to schedule an implementation release. We built Judi more like a New Jersey diner with a 20-page menu. We're ready for you, whatever you want on the menu, whatever you want to order on the menu, off the menu, customize it. It's fine with us. We're going to get you your meal in 15 minutes. That means Judi has the ingredients, tools, and knowledge to deliver what you need. Henry Ford once said, customers can have any color they like, but black. The phrase any color you want as long as it's black is how some other PBMs approach efficiency. We offer a lot of options. In fact, as opposed to that, most of our requests, customized requests, are completed within in 2/3 of a day. 2/3 of those items are completed within 1 day of work in Judi. And that's because of our approach and the tools that we've built within Judi. Our focus is on catering to individuals and customized experiences and showcasing more customizable product. Let's take a look at some of the modern enterprise integrated health benefits. We'll talk more about customization, but Jillian, do you want to talk through some cost containment features of a modern enterprise health platform?
I'd love to. So, when we talk about cost containment in today's healthcare landscape, it's not just about cutting those costs, it's about being smarter and more strategic with every aspect of the benefit design. So, on this slide, I'm going to highlight how Capital RX and Judi help drive meaningful savings by reducing waste, accelerating implementation, as Jeff mentioned, streamlining utilization management or and tailoring benefits to meet the unique needs of different member populations. Managing supply on hand to reduce stockpiling and excess costs. By configuring supply limits within the benefit design, plans can prevent unnecessary stockpiling of medications. This not only controls waste, but also reduces excess spend for both the plan and its members, which I will discuss specific cases in the next couple of slides. Fast track plan configuration. With Judi's bulk action capabilities, the benefit team can load and update multiple benefit configurations from a single file, which drastically cuts down the implementation timeframe and reduces errors. Automate utilization management. Judi supports auto determination of prior authorizations, allowing for faster access to necessary medications while still ensuring clinical appropriateness and cost control. Our automated rules-based logic simplifies this process and reduces that administrative burden and helps to avoid unnecessary prescriptions or additional services. And then lastly, tailored benefits by population segment for smarter coverage. Plans can use Judi to create customized benefit designs based on population needs, such as chronic condition commonality or specialty drug usage to ensure coverage is relevant and cost-effective. We know not every member population has the same needs, and with Judi, we can segment populations and tailor their coverage while making sure members get what they need when they need it, while eliminating a one-size-fits-all approach and efficiencies that follow that. So I think this is a very powerful illustration of waste in legacy claim adjudication and how Judi's standard supply and hand logic mitigates that waste and excess plan spend. So each blue bar here represents a series of refills for a single patient and a single drug, which in this case is Humira, coming from actual client data. Each light blue portion shows that overlapping days supply there. Now, if I can call your attention to the lower right-hand corner of this slide, you can see that over a 14-month period, this single member accumulated nearly 3 months of Humira, resulting in excess plan spend of nearly $40,000. Ultimately, the PBM controls when that next fill can be dispensed, and pharmacies tend to figure out this, or members can set up automatic refills in this specific example and dispense earlier and earlier. Some high-cost medications like Humira are really a perfect example of where supply on hand logic has real financial impact. And with our standard approach in Judi, we track the member's actual supply on hand, and then we also factor in previous fills and their dosing schedules before authorizing additional fills. This prevents unnecessary early fills that can result in stockpiling, especially with expensive specialty drugs where a single dose can cost thousands of dollars. By aligning refill timing with true clinical need, We not only reduce waste, but we also protect the plan and the member from excess spend. And I think this chart is a really great example of how our automation and smarter logic drives both better adherence and lower costs without adding administrative complexity for the plan or the member. Now, just like with Humira, GLP-1 therapies like Ozempic and Mounjaro require proactive cost control strategies due to high demand and those high price points. One key tactic that we've implemented at Capital RX is creating targeted rule sets that accumulate our supply and hand logic, as I previously mentioned, at the drug class level. So, not just by the name or the strength. This prevents members from switching between different drug classes to bypass that refill limit and then stockpile their medication. So, in this slide here, each dark blue bar represents an 84-day supply of our Ozempic, and each light blue bar represents that 28-day supply fill of Mounjaro. You can see for this one member how they were able to fill overlapping days supplies for these GLP-1 medications. Again, if I can draw your attention to the lower right-hand corner of the slide, you can see that over a 12 fill period, this member accumulated nearly a 2-year supply of medication, costing nearly $23,000 in excess plan spend. There are different and additional strategies that we can implement, such as channel management, which is very common. And that really just restricts access to specific dispensing channels, such as specialty or mail, while enforcing day supply limits. Along the same lines, our recommended cost containment strategy around GLP-1s is to limit members to either a retail or an in-house or preferred channel while limiting the member to a 1-month supply in conjunction with our supply on hand logic. This effectively reduces oversupply and ensures more consistent, clinically appropriate use. Together, these measures really help avoid both member confusion and plan overspending while still supporting access to therapy for those who truly need it. And Jeff, I'll turn it over to you.
Great. Thank you so much, Jillian. So operational efficiencies. So there was a number of things that Judi brings to those efficiencies, such as centralized configuration management and template-based design. So for instance, your benefit designs, if you have a benefit design, you can copy that design, make a change to, let's say, the cost sharing, and load that design back into Judi. You can load it in actually into production using our draft function. So we allow draft benefits in production. This enables you to test those benefits before they go live in production with production data if you decide to. Again, the integration of Judi really helps with the efficiencies. So PAT, or our prior authorization application, is integrated within Judi. So that means that PAT talks to adjudication and adjudication will talk to PAT. So authorizations are immediately available in claims adjudication. And within the prior authorization tool, you can do real time testing of your PAs against live data. Jillian mentioned bulk actions and the ability to load benefits, for instance, using our bulk action application. This is using templates or spreadsheets, if you will, and you can load, again, if you have a benefit, you can make changes to that and load up many benefits at one time. It's used quite often by the folks here to get 100 benefits loaded in. But that bulk action is not limited just to benefits. We can bulk action overrides. We can bulk action continuation of therapy, other plan information, accounts and group information, network information, including provider agreements and pricing. We can bulk action prior authorizations as well. This keeps things very efficient when you can do things offline on a sheet and then load them into Judi, and they're live as soon as you load them. The other part of efficiencies is tags and overrides. I'm going to take you through an example here of some tags and overrides from the simple to the complex and show you how easy they are to use and how efficient they are. And you might use these, let's say, a tag and override to meet regulatory considerations or make quick changes to the benefit. So before I do that, let me just define for you what a tag is and what an override is. And I'll show you the power of them. So a tag is sort of the what. It's a rule that says when Judi, when you encounter this situation, it's a true situation, or that condition is met, we want you to then launch an override. An override is simply an action. What action do you want Judi to take um, based on that it encountered the situation in the tag? Again, I'm going to show you from the simple to complex. There's a video that we're going to run, but I'm going to talk through the video so you can sort of watch and listen at the same time. And you may go ahead and launch the video, Jillian. So I'm going to do a tag and an override for injectable chemotherapies. Let's say you have an in-house pharmacy called the Carolina Infusion Pharmacy, and that pharmacy offers a discounted cost sharing if you use the in-house pharmacy. Well, we can set up a tag that says when a claim comes in and it is for an injectable chemotherapy, you'll see that by drug class, and that claim is not from my in-house pharmacy, so it's not the Carolina Infusion Center sending the claim, that you want to go ahead and when that is met, we're going to go ahead and build an override. And in that override, we're simply going to message the member. So we'll select the tag that we just created, and the action we're going to take is to message the member. Now, this messaging can go to the pharmacy, but it can also go to the member in the member app and in the member portal. And we can tell the member that, hey, you filled that you may have a reduced cost share at the in-house or our preferred pharmacy, the Carolina Infusion Pharmacy. And you can even have that be dynamic and add things like the drug name or the dates of service or other things to that messaging. That messaging can have effective dates, so you'll see that on the override as well. So perhaps this is a new thing or a program you only want to run for a month and see what happens. You can do those sort of things as well. But now we can get more complex as well. So let's say the same sort of thing. We get these, in this case, the injectable chemotherapy comes in to the in-house pharmacy. We can reduce the cost share by simply saying that when we can add a message and reduce the cost share to $100. So by selecting a custom action that the member cost share amount is $100, and again, we can add any messaging, we now can reduce that cost share at the pharmacy. So let's say we recently brought on the Carolina Infusion and we want to reduce the cost share. Now let's get even more complex and get to a custom tag. A custom tag is going to look back at prior utilization. So in this case, it's going to look back at utilization for other chemotherapy types, such as chemotherapy oral. That look back can be up to 365 days. That's our default is 365 days. And if that condition is met, where the member has filled a prior claim for chemotherapy oral, we're going to then reduce their cost share at the infusion center to $100. Why is this important? This might be a nice, fast, easy way if your state passes a cancer parity cost law that maybe takes effect in 30 days. Well, within a very short period of time, we can sync up those cost shares between your preferred and your non-preferred network to meet that law, as a for instance. It is a quick and easy way just to, again, effectuate the definition of what goes on within your benefit. This can apply to one individual benefit or your entire book of business. You don't have to do it just for the one time or for one benefit. So if you have 50 benefits, you're not going to have to go and update those benefits individually. I think we actually have looped back at this point, Jillian, if that makes sense.
Yeah.
So thank you for that. You'll notice that this video lasted just under 3 minutes. It was 4 minutes and 46 seconds. And that in that time, I created 3 tags within Judi and 2 overrides within Judi. I created messaging to the pharmacy. I created a reduced cost share. And I also looked back, created a continuation of therapy where I was looked back on prior therapy to drive behavior. So this is the kind of thing that we think showcases the flexibility, the customization, and the power of Judi, that we can do these changes very quickly and very easily. And this is why we have such a great system, and we're prepared not only for today, but for your future requirements. Jillian, I'm going to turn it back to you for some member experience.
Of course. So here at Capital RX, delivering a great member experience isn't just a nice to have, it's really a strategic control for engagement, adherence, and ultimately better outcomes. And I'm going to talk about three great examples on how we use Judi to effectuate a positive member experience. Faster access to medications. We reduce friction at the pharmacy by automating prior authorizations where appropriate, using tools like physician gold carding, where trusted prescribers can bypass a prior authorization and those subsequent requirements based on clinical performance. This not only accelerates access to critical therapies, but can also be tracked and reported on using a program specific stamp for accountability and refinement. And we use that via our tag and override functionality that Jeff just walked through. We really have a lot of flexibility when it comes to multiple programs. Um, Next is real-time benefit clarity. Through our member portal, we deliver real-time benefit insights, whether it's alerting members to a diabetes management program, reduced cost shares, or clinically appropriate alternatives, all by way of custom rule sets created again via tags and overrides. This transparency drives smarter decision making and builds trust with our membership. And lastly, personalized plan design. We design benefits that anticipate the needs of specific populations, removing unnecessary hurdles like prior authorizations for qualifying groups or providing reduced cost shares when members engage in programs like disease management. This flexibility not only improves member satisfaction, but also reduces avoidable utilization and additional spend. Jeff, you want to talk about the power of data?
I will. So, the power of data. So, we have built into Judi what we call Judi Live. So what Judi Live is a real-time dashboard that shows you everything about what's happening in your benefit, including drill downs within the benefit itself. So if we had Judi live, you would see the upper right, or I'm sorry, the upper left hand side of the screen with the map of the United States. It'll actually twinkle. It will show you as claims come through, and there's a list underneath to show you what that claim actually is. So it gives you updated real-time information. We're talking second to second on what your spend is, what your claims are. But we go much more than that. You might want to know how the call center is doing. So you can click into these little cards on the right-hand side and get a lot of information about how the call center is going, about how many prior authorizations I have and what stage are those prior authorizations. You can get a whole lot of data, summary data if you want on your plan, and you can break that down, but you can drill down and drill down until you get to the member level. So this gives you, again, the integration of Judi, where you can not just get claim. We're not just talking about a claims view and think of Judi as claims adjudication. This is really all your operations in a dashboard within Judi Live. I think you'll find there's even more interesting things here within Judi Live as we roll it out. And as we said earlier, as our gift to you, when we send out the slides, we will gift you a video. It's not terribly long. I think it's about 2 minutes that will show you Judi Live in action and how it's working. And with that, we're going to pop up another survey. And I'm going to turn it back over to Justin.
Thanks, Jeff. Yep, we're going to open it up for a Q&A here while everyone's taking a second to pick an option there for that second poll. We have a couple questions that came in, so we'll get to those very shortly. And we will make the slides available for sure. I just saw that question as well. So if anybody has any questions, now's the time. Hit that little question mark box, drop them into the chat for us, and we'll get to them. Jillian, you want to take the first one, I think? Makes sense for you?
Sure. So the first question is, what strategies and incentives have proven most effective in adoption of preferred pharmacy channels, and how does Capital RX track and optimize that engagement over time? So I think this is a really great question and one that actually does come up pretty frequently. So here at Capital RX, we really focus on aligning member incentives with that overall value and access, like I previously mentioned. We utilize really clear communication in conjunction with those meaningful incentives, like reduced copays, for example. As I previously mentioned, Judi allows for real-time benefit visibility, personalized engagement, so members can easily understand their best options, and they can use a source like the member portal that I had also previously mentioned. We then track success not just by utilization metrics, but member satisfaction and adherence improvements. So really at the end of the day, it's about making that preferred channel the most convenient and affordable choice for the member, and not really necessarily the required one, if that makes sense.
It does. It does. Thank you. We have one here for Jeff. What visibility do I have on utilization and costs in your system?
Yeah. So we did touch on Judi Live as that sort of being what we're rolling out is really a very visual way to do that and to show the integration. And that, of course, we'll be able to show you a lot of things within Judi, all within a dashboard that you can click around and get that information. Keep in mind, Judi does also have its own reporting tools built into it as well. And that reporting tool we affectionately call DORA, or our data reporting tool application. And that allows you to go and build a report very quickly. You can build just straight up, I want to see this information. It also allows for summary reports and other reports like how many of this did I have in a period of time. So we do give you a number of tools to do that. But I think really the one that's really the best for sort of depending on how skilled you are in it, you can go into Judi Live and see what's going on, or if you have really very specific questions, using the reporting application is a very quick and easy way to get the information you need.
Awesome.
There's another question in there that Justin I can answer.
Yeah, take that one from Terrence. That'd be great. Thank you.
Yeah. So I'm interested in the supply in hand feature. Does Capital RX have a list of drugs or drug classes with recommended deltas from standard refill too soon thresholds? So absolutely. Our supply on hand logic is actually it's global. So that's our standard offering. Obviously, we can customize it to whatever your benefit or plan or even population needs. We can even drill down as far as, like I had mentioned, the drug class, the GPI level. We can restrict to specific channels, specific states. We can really get as granular as you need for your particular benefit. But we can definitely provide you what we would recommend based on what we typically see as a standard based on the channel. And we can connect you with your clinical account manager to get that information.
Awesome. And then another one that always comes up, I got to ask about AI. So I don't know if Jeff or Jillian, you want to take it. I know we talk about it in prior authorization a lot and being able to help there with surfacing information. Jeff, why don't you take it? Talk to us a little bit about AI or the integration of medical and pharmacy.
Right. So Capital RX, we are moving forward with AI tools as well. So as you mentioned, Justin, some of the areas we're looking to apply it first. The prior authorization area and the member experience are sort of two areas. So, using AI for PAs, well, I think will help speed them along and keep them accurate. Member experience is a couple different ways, but one of the friction points, if you will, when you're talking about medical and pharmacy benefits, is the friction of, am I covered? I was talking to somebody the other day and they were explaining that one of the biggest things that's appealed often in medical claims is somebody gets an ambulance and decides not to use that ambulance. And it turns out that you get charged for that as a member. That if you read your benefits, the no ride fee is often associated there. Wouldn't it be great if we can deal with that friction of the am I covered with the member experience and the idea of being able to know, hey, I'm at this doctor getting this procedure. Am I covered? What it's a great use of AI. So not only AI for sort of the pragmatic stuff that we do on a day-to-day basis, like PAs and the member experience, members calling in and getting the information they need, but we're looking at ways to really integrate this throughout Judi. So stay tuned. More to come. I think is definitely an area that, like I said, we think about this stuff all the time. We're thinking about this quite a bit, and I think you'll find that as we get farther and farther along with Judi and AI, that there's just some wonderful applications out there for it. Thanks for the question, guys.
Yep. I think I have two for Jillian here. Jillian, you responded to this question, but it just occurred to me on Judi Live and other features. Everything's in one system, accessible from one dashboard with Judi, right? How easy is it to turn things on and off as needed?
Yeah, so it's very easy. I would encourage folks that are clients of ours today to connect with your account management team to get your access updated, but it's one platform, which makes it very easily accessible. You don't have to go out to different applications to see what you want and then have to go back to check against it. So yeah, I would encourage everyone to work with their account management team if they're a current client of ours and they just want that tile added.
Got it. And then the second one, how does your system help with real-time alerts or other outreach to members? You were talking about it helping with customer care earlier in the call, so it'd be great if you can elaborate on that.
Yeah, so I can answer that question. So with real-time alerts, we have the ability to create, and we have many clients today that want specific messaging to appear in the member portal that will tell them or let them know of, let's say, a disease management program. If you enroll in this disease management program, call this phone number and you can get a reduced cost share for your test strips and Lancets or your insulin. We have the ability to target those specific populations via tag and override. And then we drive that messaging to the member portal for that particular member when they're doing a drug search, for example. They want to know how much their insulin is going to cost. It's nice for them to know that there's actually a program that they can enroll in to help them better manage their disease. And then also at the same time, they get a reduced cost share to incentivize them to make sure they're compliant and adherent while getting the benefits of that disease management program offering. When it comes to customer care, we can add actual internal messaging to our customer care team that the pharmacy will not actually see at point of sale. We can do that separately, let the pharmacy know, hey, let the member know they have to enroll in the program, call this number, or it's not covered. This is the alternative, work with your physician. But sometimes we don't always want to message the pharmacy because they're busy. If the claim pays, they typically aren't transcribing the messaging to the member if the claim pays at the end of the day. So we can drive specific messaging via our internal message feature so that if a call comes into the call center, they are armed with that information that they can effectively communicate to the member for that particular claim for their situation or for that particular pharmacy if there's some sort of channel restriction in place as well.
Got it. And then another great question came in from Olivia. Thank you. I'm not sure which one of you would like to take this, so I'll just put it out there. How easily does Judi integrate with existing healthcare IT systems, EMRs, EHRs, or payer platforms? I know we push and pull data 600 plus outside entities daily. What information is needed to integrate with Judi or to Judi?
Mhm. Yeah. So a lot of this also, Justin, as you said, we do push data back and forth. It's always an option, but the open API option is also there as well, which these, essentially what this does, an API connects those systems together and allows them to transfer data back and forth with each other. What information is needed, it's fairly dependent on the platforms and what you're trying to get at. We do a lot of that today with payer platforms for accumulations. Fairly common benefit setup is to have a combined medical pharmacy deductible or max, things like that. So those are done today often through, as you said, pushing files back and forth or through an API connection. And we'd have to get together with you and talk through some of the technical details of that. But that is something we're doing today, and I think is as Judi Health matures more and more, we're going to be doing more and more of those sort of things for sure.
That makes sense. And a follow-up from Tim, are the
Um,
APIs FHR
They
addressed?
are FIRE, as the acronym, I love acronyms, is pronounced. We do have all of those available, the HIT, if you will, technology, and the FIRE standards are available within Judi.
Excellent. And I don't see any other questions in the queue as of the second, so I think we got through everything. Um, Jeff, Jillian, thank you so much for taking the time to run us through the webinar today and answer everybody's questions. If anybody has a last minute one, feel free to lob it in real quick. But if not, a final closing, thank you everyone for joining us. And we will follow up by getting the slides and the replay up on Insights. And then we'll also follow up over email. So keep an eye on your inbox. Thank you very much.
Thank
Thank
you.
you.